Good morning. My name is Dr. Sambhu Banik. I am a clinical psychologist by profession, and I want to thank Mrs. Nilima Mehra for giving me this opportunity to share some of my thoughts on the consequences of coronavirus on mental health. Our mind and body are interrelated. One affects the other. Although coronavirus is a physical disease, but the consequences of coronavirus on human beings' mental health is extraordinarily shocking because this virus is still unknown factor. Nobody knows exactly what it is, and is a dead virus with RNA. So far, there is no cure, no treatment, and symptoms are highly problematic, with the problem of breathing, requiring ventilators, respirators, etc. Because of the uncertainty, because the global pandemic, it has created great deal of stress to the people, from children to elderly. And because of the lockdown, because of social distancing, because the sky is closed, airways are closed, railway lines are closed, all the transportation, buses, Uber, etc., are closed. So people being confined in their own home, when he cannot or she cannot go out or invite anybody to come in, it creates cabin fever and stress. The stress lead to anxiety, fear, palpitation, choking, headache, pain, as well as depression, fear of dying, fear of unknown, fear of contracting coronavirus, and ultimately this might lead to severe anxiety, and that might cause someone to feel choking, heart attack, etc. We're a social being confined in the house for about 2 to 3 or sometimes 4 weeks is a tremendous stress on us. You cannot go for shopping. If you go, you cannot find certain things which you need, and also you fear that very few people are wearing masks. So fear is everywhere, and that has caused more mental health related problems. These problems differ from individual to individual. Those who have some pre-existing conditions of anxiety, fear, depression, they might react more severely than the others. But that doesn't mean that we cannot handle this problem. There are some techniques that we can use to minimize and mitigate the serious consequences of coronavirus. We need to obey the guidelines by CDC, White House Task Force, and all the experts to wash our hands regularly, to keep our mouth, nose covered during sneezing or coughing with either napkins or with with tissue papers, to maintain that you are safe and you are keeping your family safe. In spite of all those things, when somebody opens the television, that creates more problem to the many individuals. The news are always bad. People are dying. And another fear is that when someone, dear and near ones, loved ones die, friends, relatives, family members cannot have a dignified burial or cremation. Many of them cannot even send their last farewell to those people who have departed. That's caused another layer of anxiety. But every problem has a solution. As I mentioned, we need to find ways to mitigate this anxiety. We need to remain connected with our friends, colleagues, through the modern technology, email, text messages, Facebook, Twitter, Zoom, etc., etc. Also, to mitigate the anxiety of shopping, we can do the internet shopping, online shopping, through Instacart, Peapod, etc., etc. Or we can ask our young daughters and sons, children, to help us if we are elderly, to help with your groceries as well as with your medical needs. Second, we need to practice hygiene, exercise. This is an opportunity when you are locked down to walk. If you cannot walk in your own home, you can go to backyard, neighborhood. But it will be advisable to wear a mask. And that will keep you healthy. And that will also keep you stress-free. Like, for example, myself. Before that, I never had time to walk. Now I walk 2-3 times a day in the house. Because of my pre-existing condition of asthma, I feel very scared to go out and walk and catch a cold. There are many other ways of handling the stress. In case the stress level is too high and a person cannot sleep, develop chronic insomnia, nightmares, then one need to contact his or her physician for some mild tranquilizers for a temporary relief. I really do not advise people to take tranquilizers because it is habit forming. Also, one must avoid alcohol, other drugs to feel relaxed. Now, there are so many gadgets available for yoga, meditation, mindfulness. All are free. Sometimes one has to join a group or pay a little money to get this app and practice meditation. Relax. It's an opportunity also for many to get connected with their own family members. Involve the young children who are bored to do some creative work and help them their math skill, English skill, writing skills. Like, for example, I have some friends who keep me connected. Like Mrs. Nilima Mehra calls me every single morning or every single day to see how I am doing, how my family is doing. Shakuntala Mahajan calls every day to check on me and my family. Sunil Singh calls me in the evening every day to check how I am doing and what is the status of NCI members in this community. And also, one can join dance group, music group. In spite of all those things, you can also develop called creative outlets. You can now learn how to cook or plan to write a coronavirus cookbook. You might not get many recipes in the store, but you can innovate. You become more constructive, creative. You can also write your own biography, your memoir, like I am doing. I am writing my second part of my memoir. I am also sharing my old photographs from my album in the Facebook to remain connected. I have received hundreds of telephone calls as well as messages from around the world from whom I never heard. This is a time to get to know each other, to remain fully connected. We're all together. When we work together, we can solve any problem. Then there is also other avenues. Recently I read on the Facebook that Siri Pampali has developed a hobby of hydroponic gardening in her kitchen. And my grandson, besides studying, also developed a hobby of making cakes. He made such a wonderful carrot cake that is beyond description. So there are many, many different ways of handling. Also, we remain grateful. We express our gratitude to the doctors, nurses, health care professionals, the people who risk their lives to save our lives, the police, the military, the workers who work in the food stores, pharmacies, and other essential places. We must thank them. We remain gratitude. We must express our gratitude to them. This is also time to think positive. But again, there is a limit of thinking positive when things are all around bad. Whole world is suffering from that. Economic condition has gone down. 30 million people are unemployed. Just imagine how they will feel. This will increase because domestic violence, sexual abuse, child abuse. But there are hotlines for that. And many have started committing suicide. Also, that can be prevented. So there are many, many different ways of remaining calm and try to solve this problem.